Segment this week, we're focusing on skincare prevention.
Yeah, Q13's Marty Hughes is here with a special guest.
We love to see the sun, especially this time of year, but we also know the risk of skin cancer. So it is important that we prepare every time we plan to go outside. Dr. Drew Oliveira is here to walk us through what we can do to protect our skin, especially in the summer months. Thank you for being here.
Of course.
Let's talk about who's at risk for skin cancer.
Well, everyone's at risk, but certainly people who have lighter skin. And lighter skin can be people with freckles, red hair. You'll know it because you tend to burn, when you're out in the sun more. But really, everyone's at a little bit of risk, even if you're dark-skinned.
Okay, and if you have a family history, are you more at risk?
Absolutely, or a personal history. So, if you have a personal history, you're going to want to do more to help prevent future cancers and/or to monitor your skin to make sure that you're not seeing any new lesions.
Well, prevention is so key. So what is your advice for people before they head outside every day?
Well, every day you think about a few things. One, put enough clothes on. So if you're really at risk or you burn easily, slip a shirt on, make sure you're covered, put a hat on, and then of course use sunscreen. And you'll need about an ounce of sunscreen to cover your body, especially if you're going to go out and swim or things like that, and then you have to put it back on every 40 to 80 minutes. And then certainly if you need sunglasses, put some sunglasses on as well.
Do you have advice on the best sunscreen people should be searching for when they go to the drugstore?
Well, anything with a SPF of a 30 or more, that'll prevent about 97% of the sun rays to get into you. Some people like barriers like zinc that reflect the sun. Others gets into the skin and sort of prevents it from absorbing.
Okay, let's talk a little bit about the signs that we should be looking for. Something that looks suspicious that should send us to the doctor.
Well, it's sort of the ABCs of what you look for. So what you look for is and we have normal moles. The normal person has 25 moles on themselves. So what you look for is it symmetric or not? Is one half looks the same as the other? So asymmetry is number one. B is what's the border look like? Is it a smooth border or is it a irregular border? The third one is C, is the color. Is it the same color all the way through, or does it have mixed colors within the lesion? The fourth one is D, is how big is it? So if it's bigger than the head of a pencil, that's certainly something we want to worry about. And the last is it evolving? Is a mole changing? We're always told if something changes, we should get checked out. And anytime anyone's concerned about anything, please just go have someone take a look at you.
Yeah, no, prevention is key every day, even on our shady days in the Pacific Northwest. Dr. Oliveira, always good to see you. Thank you. And if you would like to learn more about this topic or see some of our other healthy living segments, go to Q13fox.com/healthyliving.
All right, Marty, thank you. Well, we are tracking